Hi, everyone. Thank you for joining me today. My name is Jessica Martin. I am the founder of Martin Management, and I'm here today to talk with you about dental anxiety and strategies to help your team more effectively address dental anxiety for your patients. So let's get going. So, things we're going to talk about today a little bit about my background and my training. We're going to talk about dental anxiety. We're going to talk about the psychology of dentistry, strategies for the whole team, trauma sensitive practices, as well as things that are specific to the coronavirus that's going on right now, and then how to take it to the next level for the practice if you're interested in that, and then a little bit about our story as well. And then we'll end with some questions and answers. So please, if you do have questions along the way, feel free to put them in the chat, but I will answer them toward the end of the presentation as well. So, a little bit about me. I have a master's degree in school psychology and in school counseling. And so, for a lot of years, I worked with kids with autism and ADHD and sensory processing disorders. And so, that's what really helped me to really understand dental anxiety specifically on a more intimate level with regard to what patients are dealing with. I also have my administrative license. So I worked as an administrator of special education for a virtual charter school for a number of years. And then simultaneously, my husband and I owned a dental practice called Martin Dental, and that's been our practice for almost 10 years now. And so I've always been a little bit involved in the practice, doing some sidelines things in the background, but more heavily involved in the last 5 years. I'm really helping to train our team and to differentiate our practice and do a lot of these great things that we're going to talk about. So that's sort of the bridge between my training and dentistry, and why I can really bring a unique perspective, because I own a practice with my husband, but I also have this training as a psychologist. And so that's what led me to launch Martin Management, which is a dental consulting business to help other dental professionals to do dentistry better, to hone in on the patient experience and help address the psychological components of dentistry. And that's a picture of my family. We have two young children that keep us very busy and make life very fun. So let's talk about dental anxiety. They estimate that at least 60% of the population experiences some form of dental anxiety, and really they have no way to measure this accurately. A lot of experts say it's even more than that. But we know that what this does is it impacts our profession in general, because if people are anxious, they're not going to want to accept the treatment that you're proposing. They're not going to keep up with their routine cleanings and exams and x-rays, and they are going to be more apt to cancel and fail appointments if they're nervous about coming in for the work that you've proposed or that you've scheduled. So it really all affects the bottom line, which is production for your practice. And so from the patient's perspective, this is really a great diagram that kind of shows the cycle of dental anxiety. And so usually it starts on the far left-hand side with a negative oral health experience. And so for some people, this starts when they were a child. Maybe they were held down to receive dental care. Maybe their parents gave them some of their own anxiety or made them kind of nervous about the dentist threatening, oh, you better not eat that candy, or you're going to have really painful fillings that you need done. Whatever it is, the person usually starts with some negative experience, which then kind of can turn into what's called dental anxiety. And then with that, they'll tend to avoid coming into the dentist, because who wants to pay to do something that makes them very uncomfortable or is even painful? And so they'll put off care, which then results in poor oral health. So they're, no longer maintaining a healthy mouth. And so now they're at some point they're going to need to come in, whether they have a cracked tooth or they chip something, or they have a painful tooth or an abscess or something like that. And then now they have to come in, which then creates another negative oral experience, because now this procedure might be, it might take longer to do, it might be a bit uncomfortable or even painful, and it probably is going to cost more than those maintenance kind of procedures. So it really creates this cycle of putting off care and only coming in when things hurt, which really just reinforces them being nervous about dentistry. So my mission really is to help dental professionals break through this cycle and break this pattern, so that we can get people on a better track to being healthy and hopefully change the perception of dentistry as well. So the psychology of dentistry, you can't see it, but I have psychology and dentistry collide. And this is what I love about what I do, because there are a lot of reasons people don't like going to the dentist. Sorry, my slide skipped there. As I mentioned, there's the stigma with dentistry. There's a lot of like shows and movies that really kind of make dentistry seem worse than it is. There's the root canal docu-series that got taken off Netflix that really made, or root cause, I think it was called, made people really nervous about dentistry. So there's a lot of the perception there with the media, and just hearing that, certain procedures are really painful, but people come in with childhood traumas. People are nervous about, having something painfully done to them. A lot of people don't like feeling vulnerable or not feeling in control, and being laid back and having someone be in your mouth does create a lack of control and emotionally speaking. And then the last part is the attack on the sensory system. And I'm going to dive further into that because that's really an area that we can control for if we understand it better. So the sensory system. So we all know what the common five senses are. What these are put in place in our bodies for is to help us, take in information around us and decide if the stimulus is good or bad. So way back in the day, these senses were keeping us safe, right? They were letting us know when danger was near, and that we should, be in fight or flight mode, or we should be relaxed. So these senses are still very much a part of how we absorb information. And in the dental environment, we'll get into that, but it's really not a good picture for the sensory system. But this is why it's important, because these senses are built in to help us make decisions about what we're experiencing. So if you think about the common dental visit, there's a lot of ways that we really assault the sensory system. And here are just a few examples. So the smell of a dental office. If you aren't doing anything to control for scent, I guarantee you that patients are walking into your door and they're being blasted by a wall of aesthetics, or anesthetic, and just the smell of dentistry. And you probably don't realize it working in the office every day, but your patients aren't there every day to get used to that smell. So it is definitely something that's off-putting. Certainly the noises of the drill and the suction, ultrasonic cleaners, all of those things are kind of noisy and can cause people to be nervous. The sight of dental instruments. So just seeing those instruments on the tray and wondering, are they going to hurt me? What are they going to do with those? A lot of people have a fear of needles. Even having clutter around makes people anxious. So a lot of sight things happening there. And the environment, often the dental environment looks very clinical, and so that can be off-putting for people as well. And then touch. So a lot of people obviously don't want to be put in pain. Again, going back to vulnerability, you're digging in their mouth, and that's a really personal and intimate area of the body. And then are we asking for consent, right? Are we telling them when we're going to be doing something, when we're laying back in the chair, when we're going to be, entering their mouth? A lot of times we just take for granted that we're there to do a job, and we just get in there and do it, not realizing how that can affect the patient emotionally speaking. And then taste. There are a lot of unpleasant tastes in dentistry, whether it's the topicals or prophy paste, different things we're putting in their mouth definitely don't create for a good experience with taste. And then a lot of people just like being numb or have very sensitive teeth. And so that's obviously going to make their sensory experience much different. And then for kids, there are a lot of other things too, but textures are especially important with kids, as well as just the things that are part of the environment. The lights are typically bright. We wear masks that make the person look a little scary. You can't see what they're doing. Our gloves, even all the things that you're doing to keep yourself and the patient safe are just probably things that kids aren't used to seeing. And so breaking that down for them can be helpful, because it makes that sensory experience alarmed when they're not sure what these things are for and what they are. So I want to give you some easy strategies for spotting dental anxiety. And if you're a dental assistant, you're probably pretty good at this, because this is a hallmark of your job, is to help get the patient really comfortable and feel calm. But this comes more naturally for some people and not so much for others. So it's really great to have a system or a form for asking people how they're doing. That can be something that's built into your new patient forms. We actually even gave all of our existing patients a kind of a comfort form to just check in. And it was actually really surprising. A lot of the people that we thought were very calm about coming to the dentist really reported on that form that they were really nervous. They just presented well, and they put themselves together to be seemingly very calm. So that was surprising, and something you might consider doing. It might be something that's recorded from an initial phone call. So when your front desk person is taking that appointment, the person might reference, oh, I'm really nervous to come in, or it's been a really long time, or they might be able to just tell over the phone in that conversation that the person is nervous. So it's important to make sure that if that sense is there, to document that on the appointment so that the whole team knows this person might be a little bit on edge, and let's be aware of that. Even simply starting a discussion once the person's back in the chair with you, and avoid saying the word anxious because you don't want to put ideas in their head that maybe weren't there, but asking like, how do you feel about coming to the dentist? And having it not be a yes or no answer, having it be open ended, like, oh yeah, I don't mind it. I actually love getting my teeth cleaned. Or actually, I'm kind of nervous. I don't know what to expect. My last procedure was painful. It's going to get them to open up a little bit. And even just having you ask that question and listening to the response is calming in itself. Even if you can do nothing else, just that person being listened to is really powerful. And then observe nonverbals for the patient. And I'm going to dive further into that because some of us are more skilled at that than others. So here's a little bit of nonverbal 101. And again, some of you totally get this, but others need a little bit more details on what this looks like. So first thing, the patient's eyes. Are they focused? Are they able to make eye contact with you? Or are they kind of darting all over, looking around the room, maybe averting eye contact, not wanting to look directly at you? That might be a sign that they're anxious. Look at their hands. Are they relaxed and open, or have they got clenched fists, or are they fidgeting with something? Those are two indications of relaxed versus anxious. The person's voice. Is it a normal tone, and is it steady, or is it loud or soft? So either variance of the voice. If it's not in the normal range, that could be an indication of dental anxiety. Or is their voice shaky? Does it seem like they can't catch their breath? Are they, messing up their words and not seeming to make sense, which goes into thoughts? Are their thoughts seemingly focused? Are they asking good questions? Are they able to respond to your questions in a focused way? Or do they seem scattered? Do they seem like they're thinking about something else? Are they not able to respond appropriately? Body positioning. This is sort of just looking at the whole body, right? So do they seem open? Are their shoulders kind of crouched in? Are they pulling themselves close into like a ball? Or are they nice and open, shoulders back, looking relaxed? And then movement. Are their movements slow and deliberate, or are they kind of just fidgeting, moving around the chair, tapping on things, playing in their pockets, just all kind of seeming all over the place? Those can be signs of some anxious behavior. Other general indicators for nonverbal observations would be shortness of breath. Having lots of questions can be a sign that they're unsure, they're anxious, they're needing reassurance. The person laughing inappropriately. Sometimes when people get stressed, they either will be really, really elated and happy, or they can be in tears. Obviously, if they're in tears, you know something's wrong. But even laughing when it's not really appropriate or funny can show you that someone's anxious and they're uncomfortable, they're awkward. If they have a clenched jaw, that might show some anxiety. Or if they're sweating. We have a number of clinical people on our team that have mentioned, oh my gosh, that person got up and the chair was just soaked. They were sweating, and I could tell they were sweating the whole time. And obviously that's going to show you that they're feeling anxious. So here are some strategies. So for the front office team, really, your job, it starts right at the gates when the person calls in, making sure that that phone call and that check-in process is really as stress-free for that patient as possible. So as much information as you can gather from them and keep it so that they don't have to repeat themselves, they don't have to go through forms again, is really helpful to calm some of those anxious feelings. Letting them know what the expectations are. So if they're booking an appointment, letting them know what to expect. So you're going to meet with the doctor first for this amount of time, and then you're going to meet with the hygienist, or whatever that looks like, letting the patient know so they can be prepared. And then also letting them know how long they'll be in the office, because obviously if they're going to be in the office for 3 hours, that's going to look different than if they're here for a half an hour, and they can plan accordingly and be prepared for what that looks like in their day. Communicate what you know about the patient with the team. So as the front desk person, you might see them in the waiting room and you might be able to notice some of those nonverbals right away. So letting the team know, hey, this is what I observed, or this is what the patient said on the phone, or when I called the other office, they maybe mentioned this or that. Just communicating so that everyone's on the same page to be able to help support the patient in the best way possible is great. And then be ready for their visit. So If they're a new patient, stand, shake their hand, introduce yourself once Corona's over, right? Don't shake hands now, but introduce yourself, be warm, be prepared for their visit in that what paperwork they might still need to fill out, if they have turned in paperwork, like just so they can sense that you're in control and you've got them covered so they don't feel like, wait, I don't remember, what did I need to do? And get all that information ready to go so you're looking like you're an efficient team. And then, like I said, tune into body language and then nonverbal communication at check-in. Sometimes people will enter the building and it takes them a little while to kind of calm down. So they might seem more anxious when they first get in, that you're going to be able to see that before they get into the chair. So again, relay that information to the team. So for the clinical team, it's important to make eye contact and as much as you can try to get at eye level when talking. So you can't really see the picture because my screen's covering it, my video's covering it, but in the picture, the assistant's trying to get down to the child's level to really make eye contact and the child's looking at a TV screen. So it's okay, she's not paying attention, but just making sure you're not standing over somebody while you're trying to talk to them. Sit down in your chair, get at their eye level, make them feel comfortable. That really goes a long way. Making sure you're just adjusting the headrest and asking them if they're comfortable. Maybe they're chilly. Maybe they're just going to tell you that they're feeling anxious when you ask about, hey, are you comfortable? Can I do anything to get you more comfortable? Ask about how the patient is feeling. And again, use some active listening here. So try not to respond, try not to provide a solution right away necessarily, just listening and then, thinking of ways you guys might be able to work around those things. Asking permission or preparing the patient for the chair to move. I see this often in offices where the patient's literally just sitting there, watching something or, looking around and all of a sudden the chair starts moving and you can tell they're startled, right? So just, letting them know, hey, I'm going to bring you down now, or the chair's going to move down, or are you okay with that? Just giving them that preparation is helpful. Explain what you were doing or going to do without too much detail. Now, this is sometimes hard for the doctor because they want to tell, all the things that they know and show how, educated you are. And that's great, but that can sometimes lead to oversharing and over making the patient a little bit more nervous than they maybe already are if you're, telling them things that they maybe don't want to know or need to know that you're doing clinically. So if it affects them, like, oh, we're going to spray some water in your mouth, or we're going to use this suction, and you can feel free to, close your mouth and giving them those I guess those areas of guidance along through the appointment without giving too much detail, just so that they know what to expect and what's happening in their body, to their body. And then again, listen and then notice those nonverbal cues that might be there. So other ideas that you might be able to put in place here, if you're so inclined to make it a little bit more enjoyable and really cater to the sensory system a little bit more, would be to offer different cushions or pillows, whether it's in the neck, the lumbar, knee pillow, just to help the patient get more comfortable in the chair. You can offer blankets. Of course, you want to make sure that you're able to launder those blankets after each patient for hygienic reasons, but then also entertainment. That can be a really great and simple way to help people with some anxiety because they're tuning in on something else that's not what's happening to them. Trauma sensitive practices. So being that I worked in a school for many, many years, we talked a lot about trauma sensitive practices because a lot of kids come to us with some pretty horrific backgrounds. But this really is something that is common that you're going to see in dentistry too. And because people that have PTSD, like they've been to war or they've had any sort of traumatic experience, are going to be more sensitive and more vulnerable, as well as anyone that's experienced anything traumatic in dentistry at all. So being trauma sensitive really just means that you're having concern for the person's physical, psychological, and emotional well-being, and that you're going to try to work around those feelings that the person might have. And so tips for this is, if you don't want to get too far into it, I mean, it could be like a question on your intake form of like, have you ever experienced any trauma? Sometimes that feels a little bit weird. So these might be situations where if you just know of the experience, or maybe they disclose this to a team member, then to be more sensitive. But some tips are to ask permission for when you're going to do things, to move them, to enter their mouth, things like that. Giving them options and a sense of control is really crucial in this as well, because people that have experienced trauma, they are more vulnerable, and giving up control is really difficult. and then make them a part of the solution and discussion, which I think these are kind of things you would do for every patient, but just being even more aware that when someone's experienced trauma, these things are important is great. So with what's happening in our world right now, I think we're going to be seeing a lot more anxiety in general about receiving healthcare and dentistry. So, more is going to come out with regard to how to navigate this as we are back up and running in the dental world. But for right now, certainly I think it helps to follow the ADA recommendations and cite that to your patients. Like, these are the things that the ADA is recommending. They've done the research, and these are the things that we're doing as a result. And you can also reference the CDC guidelines. I think these are great ways to show your patients that you're staying educated on the situation and you're doing, what is recommended for their safety and their benefit. I also think it's helpful to have a script ready that your team can follow when patients do ask questions. So the doctor might want to come up with, a list of maybe commonly asked questions and how he or she wants them to be addressed, because it really is important that everyone on your team is on the same page with this, because if they hear something different from the hygienist, then from the front desk, then from the assistant, it's not going to feel like you guys are cohesive, and that patient is going to feel that just not as secure in your, care as a team. So be prepared to discuss how you're keeping patients safe and what you're doing to increase safety in light of the pandemic, and then educate your patients on those universal precautions that you're taking now and always. And if you've stepped it up, educate them on that and why. And then utilize active listening. So if the patient just needs to tell you that they're nervous and kind of talk through what they've been feeling, listen, try to paraphrase it back. I understand. You sound really anxious about that. Here's what we're doing to make sure you're safe. So all those things can really go a long way to temper some of the anxiety that you might see coming in as a result of the current health crisis. So the next level, this is where I get really excited, because this is the heart of what I love to share, which is that if you as a dental office are interested in really being known for addressing dental anxiety in a significant way, this is the area to hone in on. So what we can do within the dental environment is create an atmosphere that is so much different than the traditional one, where we talk about all those sensory triggers that are there. We can really control a lot of those things very simply. And so why not do that, and then be the office that patients want to choose, because you're doing it better for them as in regard to the experience. So just some examples of how to create a better sensory experience. And I've developed a whole program that trains teams in how to do this really effectively. But just making sure on the far left there that the treatment room doesn't feel as clinical. So the choice in the wall color, bringing curtains in kind of softens it up. Just the colors, the aesthetic of the room matters. Those details matter, and keeping things clutter free so that the patient isn't, looking around, getting nervous about all the things that they're seeing, really creates for a nice, more calm space to be. The middle picture shows you some amenity options that I teach teams on. So there's an eye mask that I recommend you cool so that they can cover the face with those cucumbers and really create kind of a pampering spa experience, but also avoids the patient seeing the dental instruments on the tray. It prevents them from seeing hands coming their way throughout the procedure. That can sometimes be helpful for patients. And again, just feels nice and can depuff your eyes and things like that. And then the heated neck wrap is really great too. It just provides a little bit of weight on the shoulders, which can be helpful and calming, as well as the heat, which just makes people feel cozy and more relaxed. Then in the waiting room on the far right, you'll see a diffuser going to really combat that dentistry smell, as well as some fruit infused water, just to kind of create a little more of a spa vibe and atmosphere for your patients. So what is a dental spa? What does this mean? I know that word kind of sounds scary from the doctor's perspective sometimes, because you want to be known as a dental office, but really I think the word spa is helpful for a couple of reasons. Number one, patients like that word and they think, ooh, what is that? That sounds different, and I'm interested in what that means for me, because usually that word is positive. So it takes dentistry, which sometimes can be negative, and spa, and it kind of puts them together to make it a little more, seems a little more enjoyable, right, for the patient. But on the doctor side and for the clinical side of things, really all it means is that you're extremely focused on patient comfort, which most dentists claim to be, but we're not really doing a lot to really hone in on that. So it's really focused on patient comfort. You're aiming to create an incredible experience that's different than every other dental office in your community because that helps you create a niche and stand out in the market. It can make things like root canals or implants, things that people get nervous about, seem less scary and maybe even enjoyable while they get to sit there for a couple hours and get some pampering done. And then the pampering that you're offering to patients is really it's pampering, but it's also really more about calming them and avoiding those sensory triggers, helping to reduce the fight or flight feeling in their body. And then it really just means that you're a dental office that's doing more than the ordinary. You're doing things that are different and progressive, and most people like that. And it really lets you, as the clinicians, focus on dentistry because the patient's calm and happy. Now you can get in and do the work you need to do. What I really like about it from the marketing perspective is that it really creates a niche for the practice because it's really hard in the dental market to stand out and be that place that's attracting patients to you. So this is a way to do that. Um, you'll see on the left there, we like to give away a little basket every month for people that do online reviews for us or check in. And that's a really nice way to not only get some hype on social media, but also give back to our patients in a way that fits with the niche, as well as in the middle picture, you'll see some hot towels at the end of every appointment. The patient's just handed a hot towel, just again, create that experience and kind of close the visit in a nice and comfortable way. And then on the far right, the noise canceling headphones really help to drown out some of the high frequency pitch of the drill. So these things not only let you kind of make decisions for the office within this niche, kind of like a party. If you have a theme, you kind of know how to, make everything look and make everything feel. It just creates an easier decision. But also you're helping patients avoid those triggers that are contributing to their dental anxiety. So it's kind of a win-win. On the business side of things, you're tailoring the patient experience in a way that's going to help grow the business and makes dentistry easier to perform. And the reason that is because relaxed patients are more willing to accept treatment. They're more excited and eager to refer their friends and family, which is the best way to grow. They're more loyal because you're doing something different that they can't get somewhere else. So they're not, even when their situation might change, whether it's insurance or your fees change, you're going to have more value in your practice because you're doing something that others are not. And then they are easier to do treatment on and even get numb. And this was something I didn't anticipate, but as we got into this and offering amenities to patients, and I've only shown you just a few little examples of amenities and things that do help to control for dental anxiety. People are, because their bodies are more open and ready to accept treatment because they are relaxed, it's easier to get blocks, it's easier to get back in those tough areas of the mouth, and you're having to do less check-ins because you can tell they're relaxed and they're ready to accept that treatment. So these are the questions I often get asked when I talk about what I call being a dental spa. So who does all these extra things that I teach teams how to do? So it's a little bit of a shared experience with regard to the front desk, the assistants, and the hygienists. And the doctor doesn't do anything different, really, just gets to walk into a warm and relaxed patient. And the rest of the team does little things that go a long way that don't take hardly any time. I've really done a lot of trial and error to streamline this down so that it literally is within that first minute of you talking and building rapport with the patient. So it really becomes an efficient system. What is the cost of offering amenities to patients? Well, I recommend that these things be complementary to the patient because that allows you to, you're not offering anything that's a standalone service. You're not offering a 60-minute massage or a facial or something like that. You're offering a few little things that are going to help them to be more calm. And so if it's complementary, you're going to see more new patients come as a result because why not choose an office that's doing these great things versus an office that's not, if there's not really a big cost difference. And then in regard to what the cost of offering the amenities is per treatment room, it really depends on how much you want to offer in terms of the amenities. So it can be on the low end for like $200 in supplies, or you could go on the high end into like $1,000 worth of supplies if you want to do the noise canceling headphones and you want to do towel warmers and things like that. But as you can see, even with the high end of things, if you have however many treatment rooms you have, these costs are much, much less than most of the things that we invest in dentistry, and they go a long way. And then the upkeep is like $50 every 6 months just to kind of keep supplies that will get weathered over time fresh and new. So it's very affordable for what you're gaining. on the back end. And then how long does it take to get rolling? So when I work directly with offices to train on this concept, I can get it up and rolling. I actually say in 2 months, but to be more realistic, maybe 3 months, depending on how quickly they want to get things in place. But if they choose to do things on their own, I do have a package that offers to just take the content and find a leadership person in the team to kind of teach everybody and roll with it that way. It takes a little bit longer, I would say 6 months. So it is fairly quick to get on board. So then I wanted to share a little bit about the stats of our practice because it has been very astounding. It's helped our business to really explode. So we quadrupled our new patient monthly averages. And so we are now at a point where we only take so many new patients per month because we wanted to be able to make sure we could continue to see our existing patients and take care of them as well. And so that's been a great thing, a great problem, right? It pushes people out a little bit, which can be good and bad, but we're finding that because we have such a niche, people are willing to wait. They've heard so many great things, and so they are happy to wait, or they're being more proactive and actually calling ahead, not waiting till they're due, calling when they have their last cleaning somewhere else and say, I really want to establish care with you guys. Let's get that on the calendar. So that's really great. We've increased yearly production by over $400,000 each year consistently. So we're not, presenting things differently. We're not trying to do higher end dentistry. It's just kind of finding us because of the kind of patients that this attracts. So that's pretty great. We've been receiving some really cool awards as best dental office in our community. And we just have a full schedule, which obviously, impacts production in a huge way. So because we have so many people wanting to get in and wanting to get in sooner, we have a waiting list for when someone is sick or someone has to move out of the schedule. We have a list of people we can call to keep the schedule full. And that is obviously crucial for production. And then just in general, we have a calmer workplace environment. So when you're able to really care for people in a stress-free way and lower anxiety, you'll find as a clinician, as a team member, that your anxiety is less too, right? You're able to help people feel happy and comfortable. And so then you have to yourself feel that same way. It's hard to be anxious when you're in such an atmosphere of relaxation and being calmer. So we've noticed we haven't had any staff turnover since we started putting this in place 5 years ago. And, I think that's just, a great side effect that it creates a better place to work as well as for patients. And then our patient retention is great. We hardly ever have patients leave our practice because, again, we're offering so much value that others are not. And so obviously, getting more new patients is important, but if you're losing them out the back door, you're not really growing. So we need to find ways to, continue to be of value and service to our existing patients while we continue to grow with new patients as well. So I hope that you got some jewels from this that you can put in place right away in your office, different areas of the training for the front office, for the clinical team. And if you're thinking, this transformation sounds great. This is something we've, dabbled in. We just weren't sure how to do it. Now is the time. We have the time to do this training and to, come out of this quarantine in a better space and better able to serve patients. So I have a couple of different offers here today. So the first one is I can send you the Create a Dental Team That Thrives. I made it in 2 parts because it got a little bit long, but I will send you that webinar for free. And it's just ways to, really help your team be more cohesive and be more wonderful for your patients. Not really dental spa stuff, but just team building stuff. So I can send you that at no cost. I also have a webinar that will be coming up that will be offering the dental spa training in 4 live sessions. So this is something I've not done before. I'm only going to be including 5 offices because of that, but I want to be able to go through the material that I've developed with offices as a group, so we can kind of share and build off of what other people are doing in 4 different sessions. So this is a great opportunity at a really great price to get in and get your team trained on this and get it rolling before things are back up and running. So if you're interested in that, certainly let me know and we can coordinate the details. And then the other option is if you're just wanting to know more, wanting to talk through what's happening at your office, and then maybe you do decide to add a program on from that call, you would get 10% off of your program that you decided to book with from that discovery call if you're able to book it from watching the webinar. So I hope that is helpful to you right now. My email is listed right there if you want to get in touch to schedule any of those offers. I would love to help. So at this point, we'll see if there are any questions in the queue. I don't see any. So again, email me if you do have questions. We can certainly address them on an individual basis. And I just want to end with this quote because I think it's really powerful. Some entrepreneurs think, how can I make a lot of money? But the better way to think is, how can I make people's lives a lot better? If you get it right, the money will come. And that is certainly how we started with this. My mission was to help people with anxiety get through the dental experience better. And a beautiful side effect of that was growing our business, seeing more production, all those monetary results that come from doing right by people. So I thank you for tuning in today, and I would love to learn more about your office and be in touch with you here soon. So thanks so much.